Hi, I'm Dr. Douglas Faigel from the Mayo Clinic in Arizona. I'm here to talk to you today about our paper, EUS-guided portal injection chemotherapy for the treatment of hepatic metastases, a feasibility study in the acute porcine model. As you know, the liver is a very common site of liver metastases. Patients with isolated metastases are candidates for a number of liver-directed therapies. These include chemoembolization, radiofrequency ablation, and surgery. However, patients with more diffuse metastases are not candidates for these treatments. We sought to develop a new treatment for patients who are not candidates for liver-directed therapy. This treatment is called EPIC, or EUS-guided portal injection chemotherapy. In EPIC, we take an EUS scope, identify the portal vein, and then puncture it with a standard 22-gauge needle. We can then inject chemotherapy directly into the portal vein where it travels to the liver to deliver chemotherapy to the liver metastases. By taking the chemotherapy and loading it onto microbeads, or using macromolecular forms of chemotherapy, we can achieve higher levels of drug in the liver while sparing systemic exposure. So in this study, we took beads and loaded them with either irinotecan or doxorubicin, or we took paclitaxel in the form of albumin-bound paclitaxel nanoparticles and used that to perform EPIC. We did this in an animal model using pigs, sacrificing the pigs at 1 hour. For each drug, we treated 8 pigs, 4 via EPIC and 4 systemically. For the systemic injections, we did not use beads. And we did this for each of the 3 drugs. And what we found was that we achieved much higher liver levels with EPIC than with systemic chemotherapy, and we also spared systemic exposure. So for irinotecan, we achieved a doubling of the liver concentration of irinotecan when we do EPIC and decreased the systemic levels by half. For doxorubicin, the results are even more dramatic. We increased the liver levels 5-fold. Now, doxorubicin is cardiotoxic, and the heart actively takes up doxorubicin. The cardiac levels were decreased 30-fold, and these were statistically significant results. For the paclitaxel-bound albumin nanoparticles, which is sold under the brand name Abraxane, for the Abraxane, we increased liver levels about 60% and decreased the systemic levels about 25 to 30%. When we looked at the tissues under the microscope, we didn't see any negative effects. Furthermore, we were able to do EPIC in every single pig we tried it in, and we didn't see any acute complications. So in conclusion, EPIC holds promise as a new therapeutic modality for liver metastases. Specifically, it increases liver levels while sparing systemic exposure. Further studies will need to be performed to determine the safety and efficacy of EPIC. Thank you very much for your attention.